Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back. We are talking about hair loss, which is a condition that impacts millions of people around the world. We've already learned that there are all sorts of contributing factors that include hormones, medical conditions, skin disorders, and even some medications that may contribute to hair loss. Let's check out some of our viewer questions. Doc, our first one comes from Sharon from Jonia. She asks, I've read that hair loss can be hereditary. Both my parents have thinning hair as they're getting older. Does that mean I will too?
It sounds like it's a good possibility, Sharon. Yeah. More through the mother's side. If your mother has that, then probably you're more likely to have that. But, you know, stay positive.
Is there anything to do to prevent it, I guess?
You really can't do a whole lot to prevent hereditary hair loss. Okay.
Francis from Dedido asks, are there certain vitamins I can take to help my hair grow back or prevent it from falling out?
There's a whole lot of things on the market. Truth be told, if you eat a healthy diet and if you take a multivitamin, and you have a good source of iron in your diet, like if you eat meat or if you take iron as a supplement, then that's probably all you can do. There's a lot of myths about, you know, that you need to eat certain vitamins or certain foods, and it really doesn't make much of a difference as far as that goes.
Okay. Sean from Tamuning asks, how do I know if I'm experiencing hair loss or if it's alopecia? And we did talk about this earlier.
Yeah, so the alopecia has patchy, circular, completely bald patches, not thinning. The funny thing is, you know, in our immune system, our hair is invisible to the immune system. Our hair does its thing, it keeps growing, our immune system doesn't see it. And in alopecia, it becomes visible. So our body attacks our own hair, and that's what happens there, that your body's actually destroying it's a piece of itself, the hair follicle. And so that's an interesting thing, and that's why we use steroid medicine, which suppresses your immune system to help that condition of alopecia. But you would tell because they were actually coin-shaped, completely bald patches rather than overall thinning.
So they'll always be coin-shaped?
They're usually round,
okay. Yeah. Debbie from Sinahanya asks, I've heard that tying my daughter's hair in ponytails regularly can cause her to lose her hair. Is it true?
It is true. If you have a long, heavy hair, if you're pulling tight, especially here in these areas or here, the hairline will start moving back, especially in young children. So we should avoid having really heavy or tight ponytails, and braiding is another thing. If you're braiding really, really tight, it will start pulling on the hair follicle and creating traction, which will destroy it.
And there's no way to
There's no way to bring that back. No, there's all kinds of things you can try. They're not very effective, so prevention there.
Okay, and Ed from Agate asks, does Rogaine really work? Are there any natural remedies?
Rogaine does work. It has to be used consistently for months and months and months. And that's what I always tell people with hair loss, is that whatever we do, including Rogaine, don't judge until you've used it for at least for 3 months, if not 6 months, before you can say that it hasn't worked. So a way to do that is to take a photo of the top of your head with your iPhone and start using your Rogaine every night, and then recheck back in about 6 months.
And the same thing for women as well?
Same thing. There's Rogaine for women, and you can use that as well. It does stop hair loss as well as slightly increasing hair growth. So it is effective. It's not too costly.
And then you were mentioning, is it Propecia?
Yeah, Propecia or finasteride. And what that does is it slows down the, remember we were talking about the phases of hair, there's hair growth and there's hair resting. It slows down that phase of resting, so the hair is in a longer growth phase for men, and so it will appear that it's thinning less over time. It has to be taken for many, many years, really ongoing for years.
Now you mentioned a multivitamin. Is there any other vitamins that you suggest people take? I think I've seen some at the vitamin stores that say for hair, healthy hair and nails and things like that.
Yeah, it's true. Actually, I don't think that those are proven to be all that effective. I think that there's a lot of ingredients that maybe are just there, but I don't think that is necessarily very effective. At least the studies don't show it.
So just take a regular multivitamin every day.
Eating healthfully and taking a multivitamin and some iron.
Okay, any last words of wisdom for those out there who are dealing with hair loss?
Well, it can be incredibly devastating to people to lose hair, and you know, you get people coming in with their baggie full of hair that this is what came out of my hairbrush today. And so we understand that, and oftentimes it can be helped, or at least you can find the insight and at least not spend money on things that are not going to be effective. So love to help.
And so you mentioned if you think you might have it, then just come in and you can get a blood test or something.
Yep, you can have blood testing done. We can even do a scalp biopsy to take a piece of your skin along with some hair to find out if there's inflammation, if there's any other disease going on.
Okay, and you can always remember check out Dr. Lom at Express Care, located on the second floor of the Agana Shopping Center. Thank you again, Doc, for coming in. Dr. Lom will be back again next week, and we pick up our discussion on scoliosis. If you have a question, send it to us at healthyliving@kuam.com. We are back right after the break.